Welcome back to Civil Defiance. I am your host, Otto Bismarck, and today we're not just discussing a crisis, we're exposing a crime committed in plain sight with full cooperation from the very institutions sworn to protect you. I'm talking about the quiet, systemic, and utterly profitable poisoning of the American people. I call it the American slow kill. Think about this. The United States of America, the richest, most technologically advanced nation on earth, spends twice as much per person on healthcare as any other wealthy country. Twice. And yet we have a shorter life expectancy than our peers in Europe, Japan, and Australia. We lead the world in obesity, diabetes, and chronic disease. If you hired an army to protect your city, and that army took half your wealth but left the city more vulnerable than ever, wouldn't you suspect treason? Today we confront the treasonous alliance, the Uni-Party of Health, a complicit cabal made up of the food industry, the FDA, the medical community, and the predatory health insurance system. Their shared business model is simple, yet evil: profit from sickness, not wellness. They need you sick enough to need treatment, but not so sick that you die before they've maximized their revenue. Let's start by looking at what's on your plate. Our first culprit is Big Food, the architects of the American diet. They figured out that true nourishment is expensive and slow, but cheap, addictive, and shelf-stable filler. What we now call ultra-processed food is a gold mine. They've engineered your food for maximum profit and maximum addiction. They use complex chemistry, flavor science, and massive subsidies to create products that are chemically irresistible, but biologically ruinous. And the gateway drug, chemicals banned everywhere else. Did you know there are hundreds of substances allowed in American food that are outright forbidden in the European Union? Ingredients like titanium dioxide, which can be found in everything from salad dressing to powdered donuts, has been banned as a food additive in Europe because safety experts couldn't rule out the possibility of it causing chromosomal damage. Yet it's in your kids' Skittles. Potassium bromate in your bread, banned in the EU, the UK, and Canada, linked to potential kidney damage and cancer, but it's okay for your supermarket loaf. BHA and BHT, preservatives that keep your snacks from going stale, are restricted in much of the world due to endocrine disrupting and carcinogenic concerns, but they're waving hello from your American cereal box. This isn't just about different regulations. This is about different standards of human life. When did American health become so cheap? The enabler of this chemical cartel is the Food and Drug Administration, FDA. The agency that should be your shield has become the food industry's doorman. The core of the problem lies in a loophole from 1958 that generally recognized as SAFE or GRAS designation. It allows a food manufacturer to hire its own panel of experts who are often on the company's payroll, to declare a new chemical additive safe without the FDA ever having to conduct or even review a single independent study. The loophole has swallowed the law. The fox is not only guarding the henhouse, He's issuing the press releases. The food industry doesn't even have to inform the FDA what they're adding to your food. They can unilaterally declare a new chemical GRAS and put it on the market, essentially hiding behind a self-serving shroud of safety. This is regulatory capture at its most grotesque. Compare this to the European Food Safety Authority, EFSA. They employ a precautionary principle. In Europe, the industry has to prove a food additive is safe. In America, you have to prove it's actively harmful, often after decades of consumption and the resulting chronic illness. The FDA's primary function has devolved from consumer protection to post-mortem record keeping. This is how Big Food and the FDA, a key faction of the Uni-Party of Health, collaborate. The food is optimized for addiction and shelf life, not for human health, and the regulator waves it through. Now let's talk about what happens after you eat the processed poisons, the inevitable consequence, sickness. This brings us to the next most profitable section of the Uni-Party, the medical community and the pharmaceutical giants. In most developed nations, the health system is structured around preventive care. The goal is to keep citizens out of the hospital, thus saving the state or the insurance pool money. But in America, our system is an absolute behemoth of interventional care. It is a system built to treat chronic illness, not to prevent it. Why? Because treatment, especially long term, chronic treatment, is a cash cow. When you're diagnosed with type 2 diabetes, a disease overwhelmingly driven by diet, does your doctor's visit focus on a detailed, life changing, 4-hour nutritional and lifestyle consultation? No. It focuses on prescribing metformin or a newer expensive GLP-1 drug. The prescription pad is faster, more profitable, and tragically, far easier for the patient to adopt than a fundamental lifestyle change. The entire medical education system and the incentive structure of physician practices are rigged this way. Doctors, often brilliant and well intentioned, are trained in a system that rewards procedures, surgeries, and prescriptions over the grueling, under reimbursed work of true prevention. They are given minutes for a consultation when an hour is required. They are a cog in the machine. Big Pharma thrives in this environment. Why invest billions researching a one time cure when you can develop a lifelong maintenance drug for a chronic condition? The incentive structure is perverse. A simple, cheap, and effective lifestyle change, like switching from ultra processed, sugary foods to whole foods, can cure many cases of type 2 diabetes, reverse obesity, and drastically lower blood pressure. Where is the profit in that? A bag of carrots and a pair of walking shoes don't have a patent. They don't have a sales team. They don't have a lobbyist in Washington. but an insulin pump, a lifelong supply of cholesterol medication, or an endless course of blood pressure pills. That's an annuity. That's a reliable, recurring revenue stream. The sick American is Big Pharma's best customer. Our high rates of chronic disease are not a market failure. They are a market triumph for the pharmaceutical medical axis of the Uni-Party. Look at our counterparts. Why does Japan have a life expectancy nearly 4 years longer than the US? Why do European countries have lower rates of cardiovascular disease? It's not just genetics. Their food standards are stricter, emphasizing whole foods and banning the chemicals we ingest daily. And critically, their health systems often operate under a different financial model that prioritizes population health. In many socialized or universal healthcare systems, the payer, the government, or a single entity has a powerful incentive to keep people well because every sick person is a cost liability that cuts into their budget. They invest heavily in prevention, public health campaigns, and health incentives. In the US, the system's fragmented. For profit nature means every sick person is a revenue opportunity for a private company. The problem is the Uni-Party has succeeded in framing the American health disaster as a personal choice and a personal moral failing rather than a systemic, engineered outcome. The final, most cynical piece of the Uni-Party of health is the health insurance cartel. This industry is supposed to be the market check, the entity that says, wait, this is too expensive. We must invest in prevention to lower our costs. But that is not how the American health insurance system is structured. It's a bizarre, counterintuitive business model. Insurers make their money by collecting premiums and denying care, or by managing massive risk pools. They profit most efficiently when you are on a treadmill of minimal high cost maintenance. For most Americans, health insurance is tied to employment. The average American worker changes jobs every 4 years. A new job often means a new insurance company. The current insurer knows that if they invest $500 today in a deep long-term lifestyle program that prevents a $500,000 heart attack in 10 years, they likely won't be the ones around to reap the reward. The next insurer will. This is called the wrong pocket problem. This perverse incentive means insurance companies will pay for a $40,000 MRI to look for a problem, but they will fight you tooth and nail on a $50 consultation with a nutritionist or a $100 gym membership rebate. They will pay for the dialysis to treat kidney failure, but they will actively avoid the expensive long-term programs that would have prevented the diabetes that caused the failure. They are a financial gatekeeper for treatment, not a proactive partner in health. Another consequence of the fragmented for-profit insurance model is the astronomical cost of administrative waste. Our peer countries, those with single-payer or highly regulated systems, spend less than 5% of their total healthcare budget on administration. The United States, we spend closer to 30%. We're talking about billions upon billions of dollars being poured into a system of complex billing, coding, and denial of service bureaucracy. That money isn't paying for a nurse, a doctor, or a piece of equipment. It's paying for thousands of insurance clerks, lawyers, and lobbyists whose sole job is to shuffle paper and find ways to pay the least amount possible. This administrative bloat is a massive systemic tax on the American people. It makes healthcare exponentially more expensive, which justifies higher premiums, which creates bigger profits for the insurance companies. It's a beautifully destructive circle of self-enrichment for the Uni-Party. The insurance company's role is not to protect your health, it's to manage a revenue stream derived from the uncertainty of your illness, and they are doing a bang-up job for their shareholders. The American health disadvantage is not a flaw in the system. It is the feature of the system. It's the result of the Uni-Party of health, Big Food, the captured FDA, the treatment-addicted medical complex, and the predatory insurance cartel working in concert, perfectly aligned to maximize profit from your chronic illness. The slow murder of the American people is a profitable enterprise. What is the solution? Civil defiance. You must become a defector from the Uni-Party. Demand food sovereignty. Stop trusting labels. Stop buying what is banned elsewhere. Stop consuming the ultra-processed chemicals that have been engineered to make you sick and addicted. Read the European Union's banned additive list and treat it like your own. Demand your local representatives support a complete overhaul of the jazz loophole. Rethink healthcare. Stop waiting for a pill. Seek out functional, integrative, or truly preventive medicine. Demand your doctor spend time on your lifestyle, nutrition, sleep, and stress, not just your symptoms. Dismantle the cartel. Support policy that aligns financial incentives with public health, whether it's a single payer system, a highly regulated one that forces competition on quality, not price, or a massive increase in preventative reimbursement. The goal must be to make it more expensive to have sick citizens than to have healthy ones. This fight is personal. It is for your health, your children's health, and the future solvency of this nation. The Uni-Party wins by keeping you docile, confused, and sick. Civil defiance starts at the grocery store, it continues in your kitchen, and it is perfected by your choice to reject the highly profitable slow kill. That's all for this week's Civil Defiance. I challenge you to look at your next meal, your next insurance bill, and your next prescription through the lens of profit. You may not like what you see, but at least you will see the truth.